This presentation will cover cognition and how you can best manage speaking and attention, memory, awareness, perception with your resident. Cognition is a mental process of knowing and understanding through thought, experiences, and senses, and it includes a lot of things, like we mentioned, attention, memory, awareness, perception, decision-making, and judgment. We're going to go over some strategies for each of these. If you're trying to get or maintain the client's strategy, then it's best to try and simplify the environment. You want to remove distractions, decrease stimulation, decrease any clutter, and help organize the environment. Sometimes you might need to move the client out of a busy environment and into a more quiet environment. You want to prepare for whatever you're going to be doing. Explain the task. Even if you explained it just the day before and they've done it 10 times, they might need to hear it new each time. For memory, it's important to stick with the routine. If they get up every day and they use the restroom, take a shower, and brush their teeth, you're going to want to try to stick with that as much as possible. It will help keep them on track. You can provide information in writing or pictures to support the activities you've done or what's to come. Repetition is excellent for these residents, whether it's visual, auditory, or by moving. And it's okay to need to reorient and redirect the client often and use visual cues. If the resident happens to repeat misinformation, you want to repeat it with the corrected information. You don't want to say, no, that's wrong, that's not what happened, and become argumentative. So for example, if the resident said, we went to a football game on Saturday, but you know it was really Sunday, you want to say, yes, we went to the football game on Sunday. Sequencing, so this is how to know what's next in a task. You want to encourage independence by helping set the task up. Maybe you need to lay out the things that happen first, second, and third. And you want to see if the resident can organize the steps for that task before starting. Maybe asking them, what do you need to do first? What's after that? Do you have all the things you need for this task? What are you going to do with the toothpaste? What is next? For problem solving, you want to resolve issues when they come up. So for example, if you see that the resident's leg came off the footrest, you might want to ask them, your leg came off the footrest, what should we do? And help them direct their care. You also want to engage the client in active problem solving, such as asking questions. What do you need to do to perform this activity safely? What do you need me to do? What do you think is the best way to resolve this issue? What do you think will happen if you try and get up by yourself? Are you ready to move on to the next task? With behavior, best thing we can do is provide choices. We all like to have choices in our life, so it's important to give our residents as many choices as possible, because living in this type of environment, they give up a lot of choices. So you might want to ask them, if you know they need to take a shower, instead of saying, do you want to take a shower today, which they can of course answer no right away, you want to ask, do you want to shower now or after breakfast, which gives them a choice of when they want to do it. And one of those choices is not complete it, but they can do it before or after their breakfast. For the 11 a.m. activity, where do you want to sit? Instead of asking, do you want to participate in the activity? If the client is having a verbal outburst, it's important to redirect them. That might mean changing the topic, changing the subject, moving out of that area, moving on to something else, or letting them let out their emotion somewhere where it won't bother the other clients. It's very important to keep your demeanor and tone of voice calm. There are a lot of factors that can influence cognition, such as fatigue, pain, depression, malnourishment, or just being hungry, anxiety, lethargy, and medication side effects. So if these things are happening, just know that you may see a decrease in cognitive functioning, and it might be more difficult for the resident to make decisions, participate, or do the things that they're supposed to do. So you may want to address some of these things if needed. If they're too tired, help them get into bed and take a nap. If they're taking pain, you may want to remind them to get their as-needed pain medication, and so on. Just go over some general strategies that we should be using with all of our residents, which is being consistent with cues and techniques. It's very important that all our staff are giving the same instruction. allowing additional time before changing cues or introducing new items. It's okay for a task to take additional time, or if there are periods of silence, while you are allowing the resident to think about what they're going to do next. If we need to redirect them, we want to do it with gentle guiding. We don't want to argue, we don't want to put them down, we don't want to belittle them, and we don't want to get into a back and forth with them. If the task is too hard, make it easier, and keep the directions simple. Lastly, we want to provide simple choices with concrete language. Sometimes less talking is more, right? Do you want to take your shower now or after breakfast? And let them have time to make a choice. Keep the conversation to the task at hand. And if the client wants to talk about other topics, you can bring them back into the fold and say, well, we can talk about that in a little bit, but right now we're talking about when you're going to brush your teeth. Right now we're going to talk about the next activity we're going to do. You want to make eye contact with the patient when you're talking to them, and make sure that there are a limited number of inputs. So you really only want one person talking to them at a time. If there's a lot of people in the area all talking to them at the same time, they're not going to be able to process this information, and it'll likely make them more agitated. And you want to make sure that you're showing active listening to the patient, right? That's eye contact. That's showing interest with your nonverbal communication, right? That's not being distracted while they're talking to you. And watch for the patient's nonverbal cues. It may give you insight into that, hey, they're starting to get agitated, they're tired, they're hungry, they're having other challenges that you need to address.